Greg Matthews.
That's my favorite part of the show, shaking Dia's hand as I come up here. I love shaking hands with people. What's up, everyone? My name is Greg Matthews. Let's go. There I am. I'm Greg Matthews. You can call me Dr. Gregor Matthews. I didn't sit through Joe Glass's design of experiments to be called Mr. Matthews. Holy shit, it was boring. Anyway, so I have a PhD in statistics. And what she's a PhD in statistics too. Let's all calm down. So what I like to do is I like to take the theme of the show and I like to do some statistical analysis on it, and I present my findings to you because we've had a lot of jokey jokes. I want to make this educational, so what I do is a purely educational segment about the show. Tonight's theme is public health. So let me tell you, I've been researching this quite a bit. Here's my findings on public health, okay? So that's funny? All right, well then you're gonna love the rest of the slides. All right, so that's a word cloud that someone made that I found online. Public health really is absolutely amazing, and the achievements that they've been able to do are absolutely incredible. Vaccines, controlling infectious diseases, healthier mothers and babies, family planning, fluoridated water. There's nothing funny about this slide. These are all just actually good things that public health has done. So, but actually, now that I look at these slides, that entire list, if you take the opposite of that, that's the GOP 2024 running back. Sick burn to the GOP. So what I'm going to focus on tonight is controlling infectious disease. And because this is a comedy show and comedy audiences are mostly childish, we're going to focus on sexually transmitted infections because you're all children. Okay. And sex is funny, right? Okay. So, Greg, how are you going to do sexually transmitted diseases aren't that funny? How are you going to do this? Well, I'm going to argue that some of them are. So if you look at these diseases right here, these diseases, not funny, okay? Stroke, tuberculosis, not funny. But leprosy, bubonic plague, gout, scurvy, lycanthropy, very funny. Very funny, in kind of a weird way that clown makes you feel, right? If we do the same thing with STIs, we have a list like hepatitis, herpes, HIV, AIDS, and HPV. These are not funny. Yo, dog, that's not funny. There's nothing funny about those diseases. But crabs, scabies, syphilis, chlamydia, gonorrhea, kind of okay. And the reason I think is because these are all pretty curable, very humorous indeed. Thank you, data. I like data. Get it? I like data.
That's very humorous.
Yes, very humorous. But it's because I have a PhD in statistics and it's data. In case anyone didn't get that, I'll explain it for you. Okay, so these may not have been funny at one point, but now you just get a shot and you're fine, it's fine. We're gonna focus on these, the big three. Oh, I'm sorry. There's certain types of syphilis, not funny. Congenital syphilis, when a baby gets it, very not funny. But primary syphilis that you get having sex in like a Sandy can, kind of funny. Okay, anyone out? No? Okay. We're gonna focus on the big three here. These are what we have the most data on. The CDC, all the public health organizations, they track these: syphilis, chlamydia, and gonorrhea. These are the big three. We're going to look at it. And so I've also put the big three from World War II. And actually, if you can't remember the three main leaders of the Allies, those were the good guys in World War II. Okay, in case you didn't know, you can actually use the S, C, and G in gonorrhea can help you remember the big three from World War II: Stalin, Churchill, and Roosevelt. It's not perfect. It's not perfect, but you'll never forget that in the rest of your life. Roosevelt, yeah. He had polio. Not funny. Okay. I can't wait for this part. This is an audience participation part for the rest of the set. What is the nickname, what is the colloquial term for gonorrhea?
Clap.
It's the clap. What I would like the entire audience to do is for the rest of the set, the rest of the time I'm up here, whenever I say the word gonorrhea, I would like everyone in the audience to clap exactly once. Let's practice right now. Gonorrhea. I can't wait. Let's get into the national trends. So let's go look at the national trends we have over time. This is syphilis. There was a huge drop in syphilis in the 90s, and then it took off again in the 2000s, and we're kind of in the middle of a syphilis epidemic. I didn't realize this. STDs are fucking rampant right now in the US. So this is syphilis. If you look at chlamydia, it's even worse. He couldn't wait. That's the best thing that's ever happened. He doesn't give a shit. Any STD I hear, I clap. Look at this shit. Chlamydia is skyrocketing, right? This goes from like late 80s all the way through. We have a COVID drop, and then after COVID, they're like, no, we'll get some chlamydia going again. All right, and then we have gonorrhea. Thank you very much. You'll notice there's 3 big spikes right here. There's a spike in the 40s, there's a spike in the 80s, and then we're currently in the middle of one of these spikes. And I'd like to show you how public health people reacted to these spikes and tried to quell these things. And we can look at the posters they were publishing at different periods of time. So in the 40s, we had, what was going on in the 40s? Big event, World War II, right? So here's some posters from World War II preventing these things. Danger disease ahead, gonorrhea and syphilis. Good work. They don't wear labels. She's got a sandwich board that says, I got BB. Incredible. And my personal favorite, she may look clean, but pickups, good time girls, and prostitutes spread syphilis and gonorrhea. Thank you. This guy was prepared. He had his hands out, ready for me to say it. Because remember, you can't beat the Axis if you get BD. All right. Then we have the 80s. Now, I grew up in the 80s, and one thing that when I think back in the 80s, every single public service announcement, public health, the adults had no idea how to fucking talk to kids in the 80s. They were like, what should we do about drugs? How about don't start, what was it? Dare, just say no. Just say no. Oh yeah, fucking brilliant. That'll get it to the kids. There's nothing, so the entire DARE program, there is nothing funnier if you were born in the 80s than smoking a weed and hitting a bong wearing a DARE t-shirt. So great work, Regan. All right, so here's some posters from the 80s. We have, with AIDS around, gonorrhea, syphilis and herpes are fair warning. We have this guy, AIDS is scary, but a zit is real, right? They thought, what do kids have to deal with? They have zits, right? Let's put AIDS in there too. And then we have this guy who's my favorite, and you can't really read the writing, but what it says here is that some people think they come of age when they've been burnt by gonorrhea. No one has ever thought this at any age. This is what adults thought kids were going through. They're like, oh, the kids are like, I gotta get gonorrhea to become a man. Some people are paying attention. All right. So this is the current one, and I have some billboards now. This is gonorrhea alert. This is about Tinder, Grindr. And then my personal favorite, feel the burn. Okay, incredible. Okay, let's look at some statewide trends. That was all national stuff. Let's start with chlamydia. If you look at chlamydia, we have the year here. What I've plotted on here is I took each year, I found the state with the highest rate, and I've crowned a champion for each year. And on chlamydia, we have only a few states have ever won it. Early on, we have New York, we have Mississippi and Alaska, but there's a real battle here. There's a real rivalry between Alaska and Mississippi. And to show you this, it's real back and forth. It's like Ohio State, Michigan of chlamydia, right? Just back and forth. What's interesting about this, though, is that in Alaska, if you add in moose chlamydia, they actually won in 2008 and 2009. I'm going to make this commitment to you right now. If you were here in February, I made a moose divorce joke because I mentioned Alaska. I'll make this commitment to you right now. For the rest of this show, for the rest of the years that we do this show, hopefully, anytime I mention Alaska, there will be a moose reference. I'm committing to that right now. Moose chlamydia. Just making out with a moose. Gonorrhea. So here's gonorrhea. You can see that there's a bunch of these blue dots on here. There's a few purples and greens, but most of them are blue. And if you look at Mississippi, they're really kind of crushing it. And so what I've done is I've given them some banners. And, I mean, this is a dynasty, right? This is like Michael Jordan, Tom Brady, Jeter. Let's throw Mississippi up there. They're the goats. They're the goats of gonorrhea. Okay. All right. And let's look at syphilis. Okay. This is syphilis from 1995 through 2000, and you see it's sort of flat. There's a bunch of different states. The one all the way to the left is Maryland, and I think there's a Rhode Island on here. This is the only one. There's some blue states in here, which I thought was kind of interesting. All the other ones are red states. Look though, there's never been a year, so this is rates per 100,000. There's never been a state that had over 40 cases of syphilis per, these are primary and secondary, so no congenital. There's never been a case where it's been over 40 cases per 100,000. Until 2021 when South Dakota did this. Absolutely smashing records, okay? So what do you do when you have an outbreak like this? Public health gets together with the government agencies and community organizations, and they get together and they try to fix it. So I'd like to read you something from the South Dakota Department of Public Health. This was written by the Secretary of the Department of Public Health in South Dakota. Under the leadership of Governor Kristi Noem, South Dakota's approach to the COVID-19 pandemic looked different from other states. Instead of controlling, mandating, and locking down South Dakota, the state of South Dakota and the Department of Health took a different approach: freedom. And this really worked with COVID, right? And this approach also works by bringing syphilis down. The governor's office got together and they let people do their own thing, and they were able to, on their own, with the government's office and community organizations and the Department of Public Health, they actually went down, and they weren't even the highest in 2022. It was Delaware. So not only did they go down, they went down so far that another state overtook them as the champions of 2022. I'm fucking joking. Of course it went way up. They didn't know that. I'm fucking serious. Fucking South Dakota. Maybe their ideas of freedom don't actually work. All right, South Dakota. All right, so let's look at some age trends. Okay, so these plots right here are the trends for syphilis. These are broken down by age groups. The red is 40 to 44. 45 to 54 is green. So far down, we get over 65 plus with the purple curve. Notice that all of these are trending upwards. So we have syphilis, we have chlamydia, we have the COVID drop, we have gonorrhea, and they're all sort of going up here. What I want to focus on though is 65 plus. Yeah. This is Nana and Peepaw. Nursing home. Yeah, nursing homes. Yeah. No, there's like really an epidemic in nursing homes. Anyway, so look at them. They're loving underneath the sheets. They look like married. They're not. This is actually a swingers couple that lives in the villages in Florida. Okay, so I plotted chlamydia, gonorrhea, and syphilis, all of these different plots. And what you notice about all of these is that there's a sort of part in the middle where they all sort of take off. It's like flat before that and they take off. And I've added a line here. This is 2012. If I fit a trend line before 2012, they look like this. They're either flat, going down, or almost nearly flat. You hit 2012 and it just skyrockets. Okay? So I was thinking to myself, what happened in 2012? And I was like, was something changed that might cause this uptick? And I was like, well, what about Viagra? Viagra came out in 1998, so it can't be Viagra. So I was like, well, what's the other big one? It's Cialis. That came out in 2003. So then I was like, what else? What would have happened in 2012? And then it hit me. It was fucking Tinder! Tinder came out, and these old people were just like, you can't stop me with gonorrhea. Let's try that again. You can't stop me with gonorrhea. I'm in a nursing home. I lived through the Great Depression. All right. So, in closing, it's not these people that we need to be targeting when we're trying to send public health ads out. It's not really these people that we need to be targeting. It's these people that we need to be targeting. This is Charles, and it says the ladies call me Santa Claus because my dick is a gift. Also, I look like Santa Claus. And then this lady says, I'm 103 and VD can't stop me. I signed up for Tinder last night to try to find, these aren't real, obviously, right? I signed up for Tinder last night to try to find something, and the first thing I did was I was like, all right, let me go to another picture, and I swiped up. Swiping left is no, swiping right is yes, swiping up is very much like. So there's some 75-year-old woman who got one up like for me out there. What if we learned today, you aren't a real man until you've been burnt? Mississippi is the goat. The slang term for gonorrhea is, and Meemaw been riding Peepaw like a seesaw. Oh no. And there's a headline I wanted to throw in there. Florida man faces charges for black market erectile dysfunction drug case. I'm Greg Matthews. Have a great night. Wear a condom.